Video, you're on.
I'm Amy Ratner, the science and medical news analyst for Beyond Celiac, and I'm here today with a very special guest, and that's Marie Robert, who joined Beyond Celiac a few months ago as our very first Chief Scientific Officer. So welcome, Marie.
Thank you.
And I thought we would begin just by having you tell us a little bit about yourself and your work in celiac disease.
Sure. So I am a surgical pathologist. I went to medical school at the University of Michigan. I'm from Michigan, from Kalamazoo, Michigan, actually. And I did my residency training in Los Angeles at UCLA. So being the daughter of a scientist and spending time in my father's lab as a little girl, I gravitated in medical school towards the more scientific aspects of medicine and ended up in pathology as a field of study and as a residency. And my very first project at UCLA was with a renowned clinician who studied refractory celiac disease, patients who didn't respond to the diet. And from there, developed a lifelong interest in celiac disease. So I'm a surgical pathologist, GI liver pancreas specialist, who I've spent my entire career at Yale University School of Medicine, where I still am today.
So you were thinking about celiac disease back at a time where it was not as commonly known as it is now also.
Absolutely. Certainly before many of the new diagnostic tests were known. So I call it the dark ages when I was a girl.
and part of your job will be to bring us out of the dark ages, right? So we're very excited to have you here as our new CSO. But I was wondering if you can tell our audience a little bit about what a Chief Scientific Officer is and why it's important for Beyond Celiac to have one.
So the role of a Chief Scientific Officer in an organization is to bring the emphasis and activity of that organization to bringing the scientific knowledge to the disease, and to organize, to look at the world of science and celiac disease in this instance, and put together what are the opportunities, where are the needs in research, and how to put the organization's resources to work to make changes, to, in this case, to make treatments, to allow for treatments and a cure for celiac disease.
So if I'm a patient and I'm trying to figure out why Beyond Celiac having a Chief Scientific Officer matters to me, what is the way in which it is most likely to impact me as a patient?
Right. So we are going to set the research agenda in the United States, essentially, for celiac disease. We are going to define the group of people with whom I'm collecting to work on our scientific advisory board are going to define the needs for research. What is the direction in which we need to move and get the NIH to fund this movement so that we can finally have real treatments and eventually, not too far in the distance, a cure for celiac disease.
Right, and we are pretty familiar, the Beyond Celiac audience is pretty familiar with how poorly celiac disease really stacks up when it comes to NIH funding. And I think there's a little bit of a feeling maybe even that, oh, there's nothing we can do. But it sounds like what you're saying is there are things that an organization can do to change that.
Absolutely. What attracted me to Beyond Celiac were two things: the passion for making progress in this disease, and the know-how of the team. The cleverness of Alice Bass, the CEO, to pivot to research. So after making all this great movement in advocacy and education, how to cook in restaurants, etc., but to pivot towards the next thing that's really needed, which is a research.
Right. And so it sounds to me then like that will all funnel into how you set what your priorities are going to be. And I was wondering, I know you haven't been, the job is relatively new, and I know most people probably don't realize how hard you've been working behind the scenes. We do. But I wonder, have you set a top priority or a set of top priorities.
Yes, right. Yeah. No, I have. So as a pathologist, I am used to working behind the scenes. So I'm no stranger to that, and that's fine. So one of the first goals I have that I'm very excited about is creating the Scientific Advisory Council, which will consist of the absolute leaders in the country in celiac disease, be they pediatric celiac disease clinician scientists, adult clinician scientists, people from the pharmaceutical industry who have been working, actually many companies now working so hard in clinical trials and really moving the needle, moving this field along, as well as people who have more of a venture capitalist background who can help us when that great idea comes from a scientist about this is something that could really change the field dramatically. Well, we want to take that shot on goal, and we need to attract the funding that will support that research, since the NIH hasn't quite picked it up yet.
Right. So part of it then is not just putting all of the focus on the NIH. It's expanding the focus and figuring out new and other ways to get these ideas from the scientist's lab into the patients.
So exactly, what specifically we will do, and we'll be starting this very soon, is we will meet as a group, this advisory council, and think really outside the box, inspirationally. I think that Beyond Celiac will be the nidus for scientific conversation in celiac disease. And we will create a research agenda and put out requests for applications and proposals from the scientific community and from biotech and the innovators out there, the entrepreneurs who have an idea. And then we will review their applications and start funding them. So I'm very excited. I think this is a moment in time in celiac disease. There's really no other organization, advocacy group, and certainly not the NIH, that's doing what we're doing at Beyond Celiac.
Right. So it's exciting whether you're a researcher or a patient. It's exciting all the way around. So far, have you been able to identify what the biggest challenge is in achieving those goals?
So I think the challenge will be sort of synthesizing. It's a completely surmountable challenge. Synthesizing, as we begin this work, synthesizing what is known about celiac disease, putting together what's known about the immune system, how it relates to other autoimmune disorders, how it relates to infectious, viral infections in childhood, for example. What about the microbiome? How does that fit in? And then and start to formulate where the body of work that exists already in celiac disease research, and take that and look at it from a very far away point of view, and identify where to go next, not to get lost in just repeating something that's already been done, but to really say to see how that work comes together to give us the next clue.
Right, and it would seem to me too that in daily life, patients run across these things and maybe thinking of them in a slightly different way, but having celiac disease and having other autoimmune diseases, reading just some general things about the microbiome and wondering, what impact does that have on me? Knowing a bit about what role a virus might play.
Right.
And so even for you individually, these little pieces are kind of coming together. You just might not be thinking of it in the same way that the organization will think of it, and looking at it in a very big picture kind of way. Can you talk a little bit more about the funding of research, and in particular the new Beyond Celiac Young Investigator Award?
Yes. So Beyond Celiac has already begun to fund research. They're really putting their money where their mouth is, so to speak, and we have formulated an award that we'll call it an early career award. So the age is not so much the important thing here, the young investigator, but early in their career. It turns out that the field of research in celiac disease is aging out, hard to believe. And it's because of the difficulty of getting funding from the NIH. So we want to get more funding from the NIH. So we are going to fund those folks who we want to encourage scientists who have an interest in celiac disease, a budding interest, the smartest people, to pursue that career by funding their early years of research. So we already have one in the works that we're doing with an organization called the Society for the Study of Celiac Disease. We're in partnership with them, and we will continue to do this on our own with our own grant adjudicating body, which is the Scientific Advisory Council.
So in a certain way, what you're saying is that without the money that's needed to do research, you start to lose a number of people who are interested in pursuing new treatments. Right. And so suddenly it's kind of like a plant that doesn't get any water in a certain way.
Absolutely.
Right.
Yeah, all research, and people may not, unless you're in the field, you don't really know this, but all research is funded one way or another. It's not part of, if you're a physician, your institution doesn't actually pay you to do the research. You've got to earn that money from a grant organization, either the NIH or a foundation. There's no payment that comes to you to support that research from Medicare or the insurance company, as you're treating patients.
Right.
And so, known fact.
Right. One of the things that if you're watching right now and you're thinking, wow, that doesn't sound right to me, and there should be money going toward research, you can help support the Beyond Celiac Young Investigator Award Initiative. And Claire, who's keeping all of our technical systems going as Marie and I are talking, she's going to post a link in the comments that'll enable you to put your own personal support behind this very important idea that Marie is talking about, and that we hope will do great things. So I want to talk a little bit about, we know that you're a pathologist, and most people who have celiac disease, if things have been done correctly, know that the pathologist plays a role in their diagnosis because they're the person who looks at the biopsy. But I think that that's maybe the physician who flits in and out of our lives the fastest, so we know the least about what they do. So I thought, I have heard you before talk a little bit about the changes you've noticed in the kinds of things you see in the reports that you do based on biopsies in relationship to celiac disease. So I was wondering if you can tell us about those changes and other significant developments that you might have seen in your work.
Sure. So in general, the pathologist is the most important doctor that you never see, whether it's in celiac disease or any other illness, any other part of the body. So what I always say is that when I teach the residents at Yale, is that, back in the day, again, I refer it to the dark ages, when I was a trainee, when I was a resident at UCLA, if the small bowel biopsy, the duodenal biopsy, which those of you watching are probably familiar with that term, if it, normally the surface is like little fingers reaching up, and that's how you absorb nutrients, through these little fingers reaching up. And in celiac disease, the fingers don't go up anymore, and it's just a completely flat surface. So when we were training, we were taught that if the biopsy that you're looking at under the microscope, believe it or not, you can see these fingers under the microscope, if the biopsy isn't flat like this, then you can be sure that the patient does not have celiac disease, and anything that wasn't flat was never considered as a remote possibility to have celiac disease. And we could not have been more wrong, and this took some time to be proven. One of the things so we now know that even something with very tall fingers can represent celiac disease, because there are some other subtle changes that occur. The reason we figured this out is twofold. One is scientist Dr. Marsh in England, who did a whole series of studies on families and found that there was a whole spectrum of changes of these fingers. They could be tall, they could be a little bit short, they could be completely flat. And the second thing is this development of a new blood test, the tissue transglutaminase, which is an autoantibody. It means that you have antibodies against tissue transglutaminase. That's one of the things that most patients with celiac disease have.
Most people probably have. Again, it's not a test we hope they've had as part of diagnosis.
Exactly. And there are a couple other tests that are just as good, but that one is the most popular. And when I started, that test had not been discovered yet. That had not been invented, so to speak. That relationship between this molecule that we all have called tissue transglutaminase that's attacked in celiac disease. And so once that was discovered, we were able to correlate, we were able to see that, oh, gee, the villi are pretty tall, these little finger-like projections. This is not flat at all, and yet the patient has a positive antibody test for tissue transglutaminase. So lo and behold, we now know this patient can still have celiac disease. That is a major change for a pathologist. We now know this very well now. It's like old news. But back in the day when I started and throughout, I would say until 15 years ago, this was not understood at all. So huge changes.
So that to me would make me think that more people are being more properly diagnosed with celiac disease. People who would have been missed in the past.
Yes, and absolutely.
Yeah. So, has there been any movement to, let's say you were missed in the past, to what does that person do? I guess they would still have symptoms and they would still be going to a doctor, and perhaps a rebiopsy might show there might be a different conclusion.
Yes, I think that folks who have just been, so what I've been learning about as I've become the chief scientific officer for Beyond Celiac is the whole spectrum. So as a pathologist, I see the patients who make it in the door, who've seen the doctor and had enough symptoms that the gastroenterologist said, let me take a biopsy of the small bowel. That's who a pathologist sees.
Right.
What I'm learning more about is the whole group, which is a much larger group of folks who have had maybe these vague symptoms, maybe, as you say, had a biopsy earlier on 20 years ago when we didn't understand all these things so well, who are walking around just managing with some bad symptomatology and have never been properly worked up.
Right. And that, we talk about the diagnosis rate a little bit and how research can lead to improving that a bit because it's been stuck in a certain spot for a while. But when we think about managing celiac disease and treating celiac disease, currently the gluten-free diet is all that we have, and even with the research that's going on, the gluten-free diet is still all that we have. And there are some patients who feel that we don't really need any additional treatments, that they're on the gluten-free diet, they manage just fine on the gluten-free diet. They're distrustful of any new treatments that might come forward. And I wonder if you were to run into someone like that, let's say, I don't know, at a party or wherever, what would you say to them about future treatments that might be coming down the road?
So I think that I would say two things. I would say first, imagine a life where you didn't have to think about your diet at all in terms of the gluten-free diet. Imagine, and second, imagine that years ago there wasn't any treatment for heart disease, and that people died much earlier or just restricted themselves to very careful diets, or had severely limited function. And before the invention of insulin, think about diabetics. So I think that what I would say is that I don't want to say it in a negative way, like it's a lack of imagination, but to say that we accept things how they are until there's something better.
Right.
And there can be something, and there will be something much, much better for patients with celiac disease. We will look back on this era as the era when, remember when there was no treatment for celiac disease? When you just had this cloud following you around wherever you go with every mouthful of food that you put in your mouth?
Right. It's a little bit like the people who had celiac disease many, many years ago, and the only treatment they had was what they called the banana diet. And so we look back on that and feel like, what? I mean, people survived on this, an extremely, extremely restricted, and then things got better, and hopefully they'll continue to get better. It does seem like we're going to go through a phase where it'll be a treatment along with the diet first.
Yes, and I think that's what some of the clinical trials are now working on. You'll have to forgive me if I cough once in a while because I have a cold.
You'd never know Maria's under the weather, would you? I wouldn't.
Well, I'm very excited to be here.
So all your adrenaline is pumping.
That's right. But yes, absolutely. I forget what the question was.
Oh, that's okay. We were just talking about how much things can change as progress is made, and how we'll probably go through a period where any new treatments that'll come out will be something in addition to the diet, and then down the road, perhaps we'll get to a point where it'll be instead.
So if I may pivot off of that comment, to say that I would really encourage, and as a chief scientific officer trying to make inroads, and we will make inroads, and as I talk to the other scientists in the United States, one of the big stumbling blocks for research is getting celiac patients who may think they're doing okay to sign up for these clinical trials and to participate in the cure. And I really can't emphasize the need for this as any, too much.
Right, right. I wonder, you probably hear from scientists that one of the things that makes people reluctant to get involved is they don't want to consume gluten again.
Right.
And they, are fearful of or recognize that sometimes the clinical trial involves consuming a bit of gluten.
Right, yeah. No, and I completely empathize with that, and I think that would be a concern of mine. I don't happen to have celiac disease, and I guess I would only ask that people consider, a couple of things. One is that the amount of gluten exposure is of short duration over time.
Right.
That it certainly will not lead to any long-term bad effects from the disease.
Right.
It's not saying, let's just get gluten back into your life permanently and see what happens. It's a much shorter time frame.
Right.
And I think that's a decision everyone has to make for themselves, but to consider also the fact that if one can tolerate some uncomfortableness and some symptomatology for a few weeks or a month or two, that you're playing a part in something really important, you're part of the big picture of curing celiac disease, of making it so that your child, one day you might have children, they will be at increased risk for celiac disease. You might be a part of the reason why their life is going to be a lot easier.
Right, right. I know my connection to celiac disease is that my daughter was diagnosed when she was a toddler, and I can remember when she was very young thinking, it'll be cured by the time she is an adult. Well, now she's an adult, and so my thinking is, well, it would be nice if it could be cured by the time I have grandchildren. Right. So there is that sort of long view that you have of the role that you can play. And there are lots of other ways you can do it too, and again, one of those is supporting the Young Investigator Award, and also we have something that Beyond Celiac has going on. It's called Go Beyond Celiac, where you can go and just by giving your information and putting your information together by answering the surveys that are on there, that interestingly is very helpful to researchers and doesn't involve consuming any gluten. So that's a really important way too that people can participate. So we and one of the things too that Beyond Celiac is going to be doing to get all of these gears moving and meshing and working is the 2018 Beyond Celiac Research Symposium.
Yes.
So can you talk a little bit about that?
Yes, very exciting. This is a live webinar of an hour and a half length, an hour of discussion and half an hour of questions. It will be on Wednesday, October 10th. Am I saying it right? I think so. Wednesday, October 10th, from 6 to 7:30.
Claire's nodding, so we'll
from 6 to 7:30 East Coast time. We have put together a panel of 3 outstanding speakers. Karen Kelly from Beth Israel Deaconess in Harvard, one of the world-renowned celiac disease workers.
Also a member of our board.
And a member of the Beyond Celiac Board of Directors, who will be who'll be sharing for everyone who watches the entire spectrum of what's happening now with clinical trials in celiac disease. Next, we have Maureen Leonard, a pediatric celiac disease expert also from Harvard Mass General Hospital, who's going to speak about the microbiome. I mean, this is such a hot area.
Yes, yes.
What is microbiome is everything now. People are taking probiotics for all sorts of reasons. We think the microbiome, the interface between the gut and the external environment and the normal flora, etc., has a huge role in many diseases. Diseases having nothing to do with the GI tract, even the heart disease, etc. So, but there's a lot of work now on how the microbiome is important in celiac disease, and Maureen is going to share her expertise on that. And then finally, we have Dr. Stephen Miller, who is an immunologist who works actually in multiple sclerosis, but also in celiac disease, and has discovered nanoparticle therapy, and this is another trial ongoing for celiac disease. And he's going to make the linkages for us between celiac disease and other autoimmune diseases. this is also a hugely important moment in time for autoimmune diseases in general.
Right.
And celiac disease is the poster child of autoimmune diseases because it is the only autoimmune disease in which the trigger and response are actually known.
Right.
So
right.
we think that celiac disease and the information we continue to learn about it will unlock the door to many other autoimmune diseases.
It's very interesting, too, to think that what was once considered a very rare disease that hardly anybody had, and certainly nobody in the U.S. had it, everybody was sure, but that very odd, rare, nobody has it, nobody cares about a disease could be the key to a lot of other things. I find that a really intriguing thought.
And I think that's correct.
In the midst of it.
That's right.
So we've been talking a lot about science and money and research and clinical trials, but we also want to introduce you to our audience in a three-dimensional way, let's say. So I thought perhaps you might tell us a little bit about your life outside the pathology lab.
Sure.
Anything you want to talk to us about where you grew up or what you were like as a kid or what influenced you, those kinds of things.
Well, okay, that's
this will be like the
fun.
People magazine part.
Oh yeah, right. Okay, fine. Well, I already said I'm from a small town in Michigan with a funny name, Kalamazoo, Michigan. My parents are French Canadian. All my relatives come from the Montreal area, and I've told you about what I did for my education. My husband is also a pathologist. He's a skin pathologist, also at Yale. We met in Michigan. We're both from
Not
Michigan.
in the pathology lab.
I'm sorry, not in the pathology lab, but
lab.
in medical school. We have two daughters who are now 21 and 23. We like to do a lot of traveling. We're very outdoorsy people, some cultural people, like to ski. Like to get outside, do a lot of bike riding, yeah.
So maybe we'll go to we'll have to have a symposium in a outdoorsy ski resorts one of these days. That sounds good. So sometimes it can be revealing to know other things about someone. I'm wondering, people think of a pathologist in a certain way. They think of them sort of down in the basement. But I'm wondering if you can tell us a little bit about what do you keep on your desk at work? What kind of things do you like to have surrounding you to maybe inspire you? Or?
Oh, that's nice. I have pictures of my daughter and my husband. I have a bouquet of flowers, and I have a huge wall covering a photograph of the aspens of Colorado in the fall. Beautiful colors of reds and yellows and oranges.
Right, which I guess is in line with your interest in the outdoors, it sounds like,
yes.
too. So even when you're indoors, you're looking outdoors.
But I have a secret side, too.
Okay, well, yes, let's reveal. I need a big reveal,
yeah,
so let's reveal
so
your
the secret side. So we all have another me. I call this the other me. And so I was a musical theater actress in a former life before I went to medical school. It was a big part of my life, and in fact, in college, it was a choice, this way or that way, and I very happily made a wonderful choice to pursue medicine. So I did nothing but singing and dancing and acting, and still, about 10 years ago, I dusted myself off and put together, I have a professional music director, and I have a cabaret act that I perform for fundraisers in the New Haven and Yale area. Haven't done it in a while. Now Beyond Celiac is my new passion.
Right. Well, one of these days you'll have to, maybe we can make that into a Facebook
Live. Holiday party or something, the Beyond Celiac
exactly.
holiday party.
And what's funny about that, too, is, that sort of flies in the face of the impression people might have that people who go into pathology tend to be a little bit antisocial. They don't like other people so much. They kind of like to work alone.
Right. Yeah, I don't fit that mold. There might be a few I could name who do, but I guess I don't. Yeah.
No, not at all. Absolutely not at all. Claire, do we have any questions?
Just a minute left, but there were two comments that were sort of related. They were about comorbidities, additional things going on. So one woman asked, Misty from Oklahoma, my home state, asked if there's a connection between celiac/gluten intolerance and having severe allergies/hay fever as a child or adult. And another man who made a comment about also, in addition to his celiac disease, he has type 1 diabetes, and that he finds celiac disease tougher to manage than type 1 diabetes. So the allergies and
Right.
other autoimmune disease.
Okay, so let me take the second one first. Thank you for sharing, both of you. So as many of you may know, and certainly the person asking the question knows, there is a genetic susceptibility link between folks who have celiac and type 1 diabetes, and that is not an unusual correlation.
Always seems
Also,
difficult to me.
and also with Down syndrome, as it turns out, and celiac disease, and among other things. And so you make such a key point, and I use the example of life before insulin. This is, I've heard this before about that the diabetes, which is a very serious disease, is easier to manage than celiac disease. So our whole point here of Beyond Celiac is to change that equation, is to make it so that will in some time from now, that's not going to be the case anymore.
Right.
There's going to be help for people with celiac disease. We also need your help to participate in studies, and if you feel moved to donate to research, that's all fantastic. With respect to allergies in general, so I think it's fair to say, I am not an allergist, I think it is fair to say that folks who are susceptible to allergies and have, that means that your body reacts to things externally. Gluten is a thing externally. It is along the same spectrum of type of disorder. There may not be an antibody. When we say autoimmune, that simply means that your immune system makes a molecule that attacks your body. Whereas with an allergy, this is getting a little too fussy here. With an allergy, it's more that you have these little cells going around that release this thing called histamine, for example, and you get a rash. But it's not this immune response that sticks around for a while. But at the same time, that cell that's releasing the histamine is still a part of the greater immune system. So it is part of the same spectrum of reacting to stuff externally that you shouldn't be reacting to.
Right.
So it is not surprising that folks have one autoimmune disease and are susceptible to others.
Right. And it seems, too, that as research goes further and we understand more and more and more, we'll unlock a deeper understanding of how all of these things interconnect, which will be a big part of the Beyond Celiac Symposium.
Yes.
So it appears that we have run out of time.
Yep.
And so I want to thank Marie for joining us. Obviously,
let's do it again.
Yes, we'll
My
do it again.
Perhaps
she'll do a little singing or dancing. We don't know. No, I'm not. I'm just kidding there. But the other thing too is Marie's influence and her knowledge will be brought to many of the things that Beyond Celiac does. When we write about other studies, we'll rely on her sometimes review of them, sometimes her comments on them. She's done some interesting work of her own, which will be featured in one of our upcoming research posts, which we didn't get to today. But you can read about that. And so thank you for joining us. It was a pleasure to sit and talk with you.
Thank you, and thank you for tuning in.